Hello and welcome to a special edition of The Buzz. I'm your host, Vanessa Emerson, founder of Dental Speakers Bureau, and I'm excited to be here today with Brandy Hooker Evans, who's a member of our Bureau. Hey, Brandy. Thank you for being here.
Thank you for having me.
Absolutely. Now, The Buzz, many of you know who've been following the Bureau, we interview different speakers who are industry experts in different topics, and we talk about those topic areas and industry trends. And we're recording this April of 2020 when we are in kind of a limbo land with the COVID pandemic, and right now dental teams are typically not working, maybe emergency only, and we're in this kind of weird space of middle. And I asked Brandy to come and share her knowledge with us today because she is an expert in multiple things, including infection control. But let me just give you just a real quick nutshell view of Brandy's bio, just off the top of my head. And you can correct me if I don't get these things right, Brandy. So Brandy is a hygienist. Loves hygiene. I know this from talking with you, that's really a passion. But that's not the depth of her knowledge. I mean, really, she's someone who is also married to a dentist. So we have some additional experience there. Works in that practice with wearing multiple hats is my understanding, right? So understands systems, like really understands front office, back office, has a full practice view. She's somebody I mentioned who is really excited about infection control, which I think takes a certain kind of like science loving kind of person to like, that's not something everybody just loves. And I love that you love that.
Is the word you're looking for.
It was be kind, science nerd. You know, I wish I had been, and I just couldn't, I could never fall in love with science in school, but I totally get. I mean, especially right now, wouldn't it be great if we really understood at a higher level what's going on in our world? But then I also just learned that you are a CPR instructor, which is, I think, really a lot of fun. I mean, just why I mention that because you really have so much experience and knowledge in the dental practice, but on top of that, folks, she also is a speaker and consultant, so, and a mother. So I don't know when you have time to sleep. You got a lot of things going, but I just love that you have such a well-rounded depth of experience for us to draw from for this little interview that we're doing, but also for our dental meeting planners and our attendees to be able to learn from you. So thank you for that. My long-winded introduction. Thank you again, Brandy, for being here.
Well, thanks for having me. I really appreciate that. And I appreciate the forward motion that you always bring when we visit. I feel like in this weird space that we're all in, having people and ideas and task lists that keep us moving forward is crucial to our health today, but also to our success tomorrow. So thank you for being such a leader with a light and positive message to get us going forward. We are stuck in a weird spot, but that doesn't mean that we can't create goodness today and then our next chapter with purpose and skill.
Oh, I love how you put that. Very well said. So, also one thing I didn't mention from your bio is, I did mention you're a speaker and consultant, but you have spoken to some pretty large audiences. I'm really impressed with the size of audiences and I know that your topics are really well received, and that and that your attendees are really enjoying the way you bring information at a fast pace, and just the different ways you teach. And so I'm super excited today for our listeners to get to know you a little bit more. The two different topics that Brandy speaks on, one is like we would kind of generically call it in our internal talk, kind of all things hygiene, because it's just really pretty broad focus you can go, or very specific in certain areas. And Brandy's course there is Leave Cookie Cutter Care Behind, the Comprehensive Guide to Dental Hygiene Care. We're not going to be really going into that today. We'll do that on a future session. But today we wanted to pull some content from her sharing isn't always caring presentation, right? Especially right now.
Right.
Infection control for the dental professional. And, I would love for me to stop talking and you to start. So let me ask you a question, Brandy, to kind of get us started. You mentioned right now we're in the middle of the COVID-19 pandemic, and really early April. We're not sure where we're going with this or how long, and but certainly infection control is something that's on a lot of people's minds as dental teams aren't working, and for the most part, emergency only. Let's start with, is there anything from the past that we need to learn from, that got us to this point? And then I would love to move into, what we need to know right now. So maybe could we start with a view on, are there any lessons from the past we can draw from?
Absolutely. I appreciate you starting there, because when I am visiting with either a private team or my own team or a big audience, we start with why. Why do we do infection control? The CDC has a guideline, the OSHA guidelines for what we should be doing. This is what we learn in school as clinicians. Then we get out into practice and everyone says, oh, here's the real world. Oh, this is how we do it here. Oh, no, 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 no. We don't do it like that. So our standards fall, and they fall fast. And then they become part of what we do every day. And if you do something every day, it's your habit and it is hard to change. So when I visit with those people that we were just discussing, I start with why do we do it? And I always share my story about, I have a patient, his name is Marty. He's a business gentleman in about middle 50s. So he's, at the time, was roughly the same age as my dad. And I tell this story about how he contracted hepatitis C from a dental office in California. And I paint his picture and I sock everyone in the gut with, why do we want to do a good job with infection control? And then our how-tos after that, we've remembered a real human being that has been affected by this. So moving forward, I'm not the only one that has a Marty. Now with COVID, we all have lots of Martys. I'm not able to go visit my granny who's 87 right now. That sucks. But why are we doing what we're doing? It's because of a very important purpose of preventing the spread of disease. So what I would love to see is, instead of graduate down, this is the real world, I would love to see our community rally and let's get up to what we learned and know is right. Our infection control guidelines that are current before COVID, this is after AIDS, this is after hepatitis, this is after SARS, and we have good protocols, but when we're not doing that yet, it creates this gap. And I think while we're working in this weird space, if we can examine that gap and start to create a doable task list that doesn't feel like we can't manage it,
Yeah,
we can get some traction while we're in this weird space. And honestly, you said, what can we do next? I would invite every clinician to think about their operatory right now and think about what's in their operatory that maybe shouldn't be. For example, your snacks. For example, your toothbrush. For example, your cosmetics. What is in your operatory right now that is not a procedural item that you need to have? And while everything's closed, when no one's at the office, go to your operatory, take a minute, clean it up, take everything out that should be in the locker room or the break room, and promise yourself that you are going to get back to where we know we need to start from. And then we can add whatever additional guidelines come our way. But first, let's fill the gap. Let's work together, fill the gap. We'll do bite-sized pieces. so that it doesn't make you feel like there's nowhere to start. I'm lost. What am I going to do?
Where do we go to? So I'm thinking that practically then, so we have so many teams that, well, I would assume all teams are not working day to day right now in the United States and probably other countries. So we do have the ability to go in and clean out our own particular work area. But what can we do as a team? What do you suggest as far as like maybe the dental practice owner organizing maybe some team meetings or something to where we could, you mentioned a plan, like coming together with their own plan. Can you talk to us more about that? Because no, I'm not a hygienist. Really, the only time I ever worked in a dental practice, I was more of a marketing function. It was more administrative. So I don't have personally that clinical knowledge. So like I've never worked with OSHA or those kind of guidelines. Like for most practices, would the average, the normal team member be able to easily put their hands on what those guidelines are? Where should that be? And like, this creates questions for me. Like, is that easy for me as a front office person or whoever to know those guidelines?
There's a couple ways to find the guidelines. Typically, you don't have to look far because your dentist and dental hygienist team should have both been trained to the OSHA standards in school. So the information is somewhere.
You have like an OSHA binder or something, right?
Yep. And the offices are supposed to have an OSHA binder, which is one of the things that I frequently help them with because that's an easy one to just not do. But you can get on the OSHA website and print the guidelines for your team. It's really easy, and you can find it through OSHA.gov is the easiest way to get to those specifics. And as far as a team plan goes, I would invite everyone to know that they need that OSHA binder, but to not know that they have to do it all at once. I would start as a team, either an email or a text thread or a group Zoom meeting, and talk about PPE. I would first start with, how are we doing the big four? Glasses, mask, lab jacket, and gloves. That seems really simple, but you would be amazed how many masks get worn down here, or safety glasses that aren't worn because they get foggy or they get pushed up in your hair barrette.
They're so cute.
So cute. That's my summer look with dirty hair, right? Like you just put your sunglasses in and you can go 2 more days, trust me. Well, no, you can. So I would start with PPE, and the one that I get the most pushback from is the lab jacket. People say it's too hot, or it's, everyone's got a reason why their short sleeves rock. And I agree, I love a short sleeve, but I would love for people to think that if you've got that lab jacket on and anything that is spraying on you, you get to take off when you go to lunch. And then what about those little babies that come into your office that are like, Mommy! Like your little niece comes in and she's 3 and she's gonna run and jump and hug you.
And all those germs.
But you don't want to hug her with that jacket, so you just unzip that lab jacket and you can squeeze and hug and smooch, and then when it's time to go back to work, you put that lab jacket back on, and it is an entire physical barrier against your day. And so the other thing is gloves. I see frequently people wear the gloves. Have you ever been to a food service place where the person makes your sandwich and then gives it to you and then hands you your money, or you hand them the money, and then they go back to the front of the line, and then they make your husband's sandwich, and then you come, right? And it's like the gloves are protecting this. We want to consider, like, when are these gloves contaminated, and should they ever go on a keyboard? Should contaminated gloves ever go on a keyboard? The answer to that is absolutely not. But that happens. So we want to think, like, what's the PPE for? What do we do with it? And make a good decision as a team how we're going to come together and follow the guidelines that we know to be correct.
So to just summarize there, so that was 4 areas in the practice that are kind of really important, obvious areas that we then right now, while we're not working, we can meet as a team, have some discussions, and come up with our own, compare it to the guidelines that the CDC puts forth, and make sure that we maybe have a commitment from our team members of what we're going to do going forward. I think that sounds like a really good idea. Is there anything else we can do right now? I mean, because especially, I mean, with COVID, it's going to be important that we understand infection control once we go back, because with no vaccine, no real treatment in place, when we start working, I mean, we're still going to be under some level of regulation and infection control, wearing masks or something, right? So this is going to be a hot topic for some time. So what other things should we as a practice be doing now?
Well, the next step I would suggest is to pick someone on your team that can get down with their geeky infection self and put them as the leader. You know, it's great to have lots of cooks in the kitchen, but if we can have one chef that's like, I am the infection control master, and have that person help guide the team and be the place where you say, so for example, you don't wear lab jackets yet as a team. But in order to have that happen, you might need to order a new set of lab jackets. And with everyone not working, it's going to be very hard to request a whole new wardrobe for every day of the week. But if you're a practice that currently isn't working with lab jackets, you can order 1 or 2 for a small amount and then build up. It's say, we're going to start with lab jackets, and Brandy's in charge of our team. She's going to do the research and find out, you know, one, and I'm going to grab everyone's sizes, and just start small and do one step at a time. Start with PPE, then move to your operatory. And if you print the OSHA guidelines, you'll see there's a wealth of things that you have to work on. But I really want you to, each and every person, to consider, what are we doing that's good right now, and what are the steps to the next piece? So one thing at a time, commitment from the whole team. Master something like, okay, we've got PPE covered, check. Next week, we're going to get on Zoom and we're going to talk about red zone versus green zone. And if you're not familiar with that, that's red zone is contaminated and green zone is never contaminated. So keeping contaminated and uncontaminated separate at all times. Mm-hmm. So okay, just one, check it off the list, one at a time.
So these are some things we can do now, and then when we receive the opportunity to open up again, fully or partially, yeah, with I'm sure with guidelines as to how we do that. So it was Dr. Paul Homily. I was interviewing on Facebook yesterday, who referred to this point we're in as like the eye of the storm of a hurricane. Because we had like the whole disruption, and now it's funny that we're kind of like, okay, like life's feeling kind of normal. It's kind of weird, but it feels kind of normal. And at some point we're going to hit that other edge of that storm where we start going back to work, and not that it's going to be the same level of disruption, but a different kind of disruption. Now we've had all this history. Now we know where we're at, and now we have to like put pieces back together that are going to fit differently. So knowing what we know now, and there's so much we don't know yet, when we hit that other side of that storm that we're in, what can we do to ensure that we have a smoother transition on that road to recovery? How do we not just start going back and seeing patients and like, it's like people will write their vision and it gets framed and put somewhere and nobody ever looks at it again? How do we make sure that doesn't happen with these plans?
I think that is a fantastic question. And my first immediate knee-jerk reaction is for each item, each piece of your vision, and in this case, we're talking infection control. Find someone in your team that can fulfill a leadership role that's going to serve many purposes. First, it's going to help guide the team. The ADA is going to release some new guidelines for when we go back, as you're saying. And so we want that person that's in charge to be able to take the guidelines, learn what they are, and then present them to the rest of us as a team. The second thing that's going to do is it's going to give someone that you didn't necessarily know was interested in it a chance to shine. It's going to be a chance to build your team. I mean, I know we're talking infection control, but all of a sudden when you have someone step up and say, okay, I've got this, you're going to watch the team continue to transform, because now we're not just all looking to the dentist or the office manager with dear eyes. Now we've got someone leading that infection control ship. And then I would encourage the next conversation to be with your front office, whoever does the scheduling, to put them in charge of how do we do this increased patient load, because it's going to be heavy for a while. How do we do this increased patient load sans the chaos? Mm-hmm. For example, many offices are going to be open longer and more days. So then we have a chance to say, okay, Brandy's going to do infection control, and Lonnie is going to be in charge of scheduling without chaos. And so then you've put yet another person in a leadership role, and here we go, our team's growing again. And all these little teeny tiny tweaks just snowball, and then pretty soon, with the different facets of the business and the clinical care, with someone that is interested in each aspect leading and guiding us, we've got a room full of goodness and a team that's working better than ever. And instead of going through the day and being so stressed out and leaving feeling like you got hit by a truck, that person in charge of the schedule made sure that everyone took a lunch and took a breath. That person in charge of infection control made sure that they took the latest update that came again this morning from the ADA or wherever, the CDC, and they are on it. And they said, team, today we are supposed to add X, Y, and Z. This is what they're saying. This is how we can, so instead of these like chickens with their heads cut off,
chaos.
We're popping up teams with leaders, not one, many.
Love
and
that.
hopefully by the time we get ourselves put back together and we get to that place where we're going to open, teams have identified who can lead what, and we're ready to rock it. We've put the plan in place, and it's not one plan for someone to take the whole thing and go. We've created a team of leaders that is going to take us into a next chapter that actually might be better than the last. Why not?
I love that. You're tapping into something that I saw on Facebook. It was Simon Sinek's, Start With Why, Simon Sinek, who's a big TED Talk speaker and an amazing motivator, like everybody loves. And at the beginning of this economic crisis, as a speaker, it was really hitting his business, and he had an entire team, like 15, 16, 18 people on Zoom with him. And somehow there was a video of this that was leaked when he talked with his team. Did you see that too?
I loved it.
Yeah, and so he started, it reminds me how he said we have to start with the why. Again, like the why we do what we do. And I think I want to encourage dental teams to think about that, like, well, because the world has shifted. It will not be how it was before. It's just gone. That's gone. But what's ahead of us could be amazing. And so what he pointed out in there was that there is a place for you. Your job will probably look very different, but there's a place for you here. And I think that applies to all of us and all of our businesses, our organizations that are providing CE, as dental team members, as dentists, like all of us across the world. We have to pivot. We have to pivot. And in order to survive as a business, in order to survive as a dental practice, our patients, I think, as a patient, I can say, I'm gonna be watching, because everybody's, their meter or their like radar for this is like off the chart. We were at Costco yesterday and somebody was teasing one of their workers that was there. He must have been teasing because I heard him walk up to somebody and says, I'm going home, I've got a fever. He was behind me, but then he stayed, and I thought, he's young. I think he was teasing. But you know, you're just like, whoa, don't be here. You know, and something like that you never would have thought about before. Everything's different. So
Yeah.
I'm just cheering on here, saying like, I completely agree with you. And I love this idea of letting everyone emerge as a self-directed leader. Like, let's all take responsibility. Let's have the opportunity to really shine in some new and exciting opportunities, which can ultimately help the practice. So, okay, so we talked about some things we can do now, pulling together that plan, what parts of what areas we might even want to focus on first. We've talked about coming up with we're starting our road to recovery. We've got the opportunity to isolate, not isolate, but like point out who would be great leaders in certain areas, not just around infection control, but throughout the practice and all the responsibilities, all the different processes. I love this idea of giving people the opportunity to have ownership, to have ownership of certain processes. That's so empowering. Is there anything else before we wrap up here in a few minutes? Is there anything else that we haven't talked about that would be important to talk about either the current situation of what we should be doing now to prepare, or that getting back to our new normal?
Well, something that is beyond important to me, and I say it in every opportunity that I get, whether I'm speaking to a crowd, visiting with my family, or just in my office, we want to show people that we care. And in light of the COVID pandemic, I would love for every clinician to wash their hands in front of every single patient. Whether you've just washed your hands before you go and get them, I invite every single one of us, myself included, to never skip the part where you wash your hands so the patient sees that you are taking care of them.
Yeah.
They need to know that you are focused on providing excellent care that is safe and meets their needs of their worries. And our patients and our coworkers are going to be a little nervous. So we need to actively make the shift and be conscientious, starting with something so simple as just wash your hands in front of everyone. Let them know, let them see that teeny tiny 30-second dry your hands is going to make a difference in your entire day, in your patients' lives. And I feel like often we overlook the smallest things that make the biggest difference. So to all my clinicians that happen to have seen this today, that's my one. If you could just do that one thing, start there. We can build from there.
Oh, I love that. I love that. Thank you. And thanks for sharing your ideas around this. I know you have so much more to share, but we unfortunately have limited time. I want to come back to that in just a minute about what other ways can we get more information from you on this as far as other workshops you offer, that sort of thing. But before we go, I just also want to point out that you're someone who's always so positive, and you had made a comment to me at one point that I just really, I really hooked into, and I've shared that thought of being someone who's a searcher for silver linings, a silver lining searcher. So even in that storm, there's always, there's always an opportunity. There's always opportunity, and keeping eyes wide open. Do you have thoughts on that for the dental team that right now, given this situation where we're at, which can feel really overwhelming to people?
Mm-hmm.
How can we look for those silver linings, or what should we be looking for there?
So I love that. That was on my fridge. I posted it for my kids on our dry erase board the other day, and I said, what is silver lining searching? And there's a couple of thoughts on that. The first thing that I'm trying to teach them as human beings, and this applies to our dental people that are not working right now, there are things in life that hurt. And being able to sit in the hurt and know that you're okay and that you're going to have the opportunity to grow from this makes it okay to hurt. And so learning how to embrace the suck is what I like to call it. Just embrace it.
Embrace the suck.
Embrace the suck. I got that from Miss Rachel Hollis. So if anyone's seen her before, they'll know what I'm talking about. And then the second part to that is to focus on gratitude. The more you see things that you appreciate, the more they're present. For example, you had a really delicious cup of tea and you're like, oh, I'm grateful for my tea. That turns into, I had a really great breakfast. I'm grateful for ingredients. And then we take that into the dental world and we think, I'm really grateful for my dental hygiene license. I'm really grateful for my patients. It really hurts that I'm not seeing my patients right now. But I can't do anything about it. So I just have to hurt and know that I'm going to be okay. And I'm grateful for my patients and the opportunity to take care of them.
Yeah.
So then that silver lining is now I am more mindful and more specific and more purposeful about the way that I take care of them. My infection control is going to be on point. When I go to get someone out of the waiting room, I won't be calling them like a dog. I'm going to walk up to them and say, I am so happy to see you. From the first second that my patients see me, they're going to know that I am grateful for them. So the opportunity to grow into this clinician that is acting from love and gratitude, again, wow, what a day. How are you going to feel at the end of the day after all 8 patients you took care of know that you loved them and you were careful with them and you did a great job? And so my point to all this is that this next chapter is our opportunity to be our best self. This hurt that we're experiencing now is our time to hurt and feel bad and cry and cuss and whatever you got to do to know that you got to hurt right now. It's okay. Do that. And then let's write out the plan. What kind of clinician are you going to be next? What kind of meeting planner? What kind of dentist? What kind of friend? Who are you going to be next? This is our chance to hurt and grow, and they don't call growing pains pain for nothing. Like, this sucks and it's going to be awesome.
Yeah.
Our next chapter is going to be beautiful.
Yeah.
Purpose and skill. We can do this. We can do this.
I think it's those lows that really help us appreciate the highs too, don't they? And we will have a very different high. I just love that. I get inspired every time I hear you speak like this. I appreciate it because you see it so clearly and it helps others see it clearly. And you know, that's probably a really great place for us to wrap up here. But I want to just let those who hung with us, thank you for watching, and you'd be able to learn more about Brandy's presentations at Dental Speaker Bureau, dentalspeakersbureau.com. And if you just look in, just put in Evans would be the easy way to look that up if you search, or you can pull up, find a speaker and it's by last name. But her courses are there, this video will be there, there's more information there, and her contact information as well. Or you could reach out to info at Dental Speakers Bureau and I'd be happy to connect you. Brandy, what's your email address? They want to reach you.
StellarOutcomes@outlook.com.
StellarOutcomes@outlook.com. Perfect. And so we talked a little bit when we started around your speaking presentations, which I'm sure you, like everybody in the industry, is able to do those virtually, given the fact that we can't meet in person right now. But going forward, I think what's going to be really great is that we'll be set up to be able to do more virtual presentations, which just makes sense in some situations. So we'll definitely be back to where we're meeting in person again. There's just, throughout time, for centuries, we've always met in person. That's not going to change. And I don't worry about that at all. But in the meantime, before we get to the point where someone could sit in your audience, if there were a doctor who wanted to work with you, or if there were a team member who, wanted to bring you in to help coach their team through this, I gotta come up with a new name for our like eye of the storm limbo land that we're in. This time period we're in. If they're seeking some additional help from you, stellar outcomes at outlook.net or com, right? Outlook.com.
.com.
Your website. Oh, say I got it. You give it. I got it mixed up.
No, that's why it's confusing. My website is stellaroutcomes.net, but the email is stellaroutcomes@outlook.com.
There we go. Okay, that is a little confusing, but
I know.
We'll get that fixed.
We'll work on it.
We'll work on that. Yeah, there's always more to change for all of us, isn't there? I mean, I'm no exception to that. So I would encourage you to go to Brandy's website, reach out to her via email, follow her on Facebook, however you can get a hold of her, but reach out to find out more about how she can help you with your team. Right now, this is something that we really need in the industry. We need to have these plans in place. It's going to really help you be able to move faster when we get back to the point of getting back to work. So that's my summary for the reasons to work with Brandy. I think that's one of the top of the list, is like right now, especially on this topic, would be a great time. So thank you again for being here and sharing your joy, and your love of dentistry is so obvious and really valuable information, Brandy. Thank you for helping point us in the right direction.
Thanks, Vanessa. I really appreciate you having me, and I believe with my whole heart that this is our chance to make the next chapter fantastic. So let's do it. I'm on your team. Let's do it.
Woot! Absolutely. I've never ended one of these with a woot, but there we go.
I'll party anytime you want. I'm in. Let's have some fun.
All right.
Some things are hard, so let's have some fun while we're at it.
Not Friday night, but it should be. So when we hit the stop on the record, we'll party for a few minutes here. All right.
Well, Vanessa, thanks everyone for joining us.
Thank you, and until next time, be well.